The United Nations has warned that some 700,000 children are at the risk of suffering from severe acute malnutrition in Nigeria. It added that up to 2 million children under the age of 5 are likely to face the most immediate and life-threatening form of malnutrition in states like Borno, Yobe, and Adamawa, northeast Nigeria. Hello and welcome to the program Health for Living on Trust Television. I'm Aisha Salihu. Today we're taking a look at the challenge of malnutrition, acute malnutrition in parts of Nigeria. And I'm in the Ministry of Health where I have with me
Urapa John, and I'm a director and the head of Macronutrient Deficiency Control in Family Health Department, Nutrition Division.
Good, and he's going to help us to, reel out some of these challenges and also the way forward. I mean, at what point would one say this group of persons is suffering from malnutrition or these children are malnourished?
Malnutrition is a situation whereby a child is either being obese, that is having too much to eat, that's obesity, or having little or nothing to eat, leading to too much wasting, or you can say emaciation, but that is not a nutrition language. I say wasting. The child has wasted so much. The child also may be stunted, that is too short for his age, or too thin for his age. That's wasting.
But then again, this has become a challenge in the country. And what would you say are the likely causes of undernutrition or malnutrition among these group of people? I mean, infants, adolescents, teenagers, and even women.
There are a lot of factors, ranging from ignorance on what to eat, poverty, and also scarcity. Food scarcity also can lead to it, because if you don't have food available at the right cost and accessible to the people, they may not be able to meet up their daily nutrient requirement. And when the child, especially the vulnerable groups, that's the under 5 or women, or women of reproductive age or lactating mothers, when they don't have enough of the nutrients they require for their daily development, they may be down with this. Even insurgency, as we see in the Northeast, where you have IDP camps everywhere, people are taken away from their homes and camped somewhere where they don't have access to farm, they don't have access to food. They are dependent on whatever that was given to them. There's no way they can have enough to address their nutrient requirement. So in that case, you will see malnutrition with setting. That is mostly undernutrition. With setting, the child will begin to waste, too thin for his age. You see stunting will set in. You even see, women of reproductive age, so they will become anemic. These are all malnourished situations. Some of them will begin to lack iron, dietary iron. So all these things will contribute in affecting the health of the children, especially micronutrients. If micronutrients are those small vitamins and minerals required by the body in minute or small quantity for proper development of the body. So where someone is lacking it, it has so many consequences. And these consequences is what we have just enumerated. It can lead to, the child being wasted. It can lead to the child being stunted. It can lead to the child, lacking uh, blood. It can lead to so many consequences. But when you come to protein or carbohydrate deficiencies, that is when you see the child suffering from what we call most times kwashiorkor or marasmus.
All of these diseases, for so that people can get a better understanding of the dangers that are posed by these diseases or these conditions, the consequences of not having your nutrition up to the level it is expected. Would you elaborate on these conditions amongst
Yeah.
children, women, even lactating mothers, and all that?
Okay, let us take it from this angle. We have what we call macronutrients and the micronutrients. The macronutrients are the building blocks of the body, like the proteins, amino acids, right? So when these ones are lacking in the body, you see the child will develop what I mentioned earlier. We start to suffer. That's the consequences. We begin to suffer from marasmus or kwashiorkor. The child, when you touch the body, it will depress. The child will be too weak. He cannot play like every other child. And you see, the child cannot even develop like a normal child. So the other way around, when the child is suffering from micronutrients, which I earlier mentioned, the micronutrients are the minerals and vitamins. They are required by the body, in minute amount for proper development of the body. Minute amount, I mean in small quantity. They are nuggets, and those small quantity, if they are not there at the correct amount or level they should be in the body, the child may begin to lack. For instance, if it's vitamin A that is not in correct quantity, the child will begin to lack what we call, you begin to suffer from what we call VAD, vitamin A deficiencies, which may lead to blindness, which may also lead to the child not having a good immunity. And immunity, if you don't have strong immunity, you will suffer from a lot of illness, diseases. Anyone that comes around, your body will attract it. Then also you see some micro nutrients like iron. If you don't have enough iron in the body, which is a precursor for building blood in the body, you begin to lack blood in your body. And once the person begins to lack blood in them, you say that the person is suffering from anemia, which could be dietary anemia or other forms of anemia. We also have what we call vitamin C. It's also a micronutrient. If you lack vitamin C in their body, we all know the problem. Vitamin C is very, very important for women of reproductive age and lactating mothers. Lack of it, mostly cause some consequences in the body, like folic acid too. Folic acid, we know, is very small, combined with iron, as fast as iron folic acid, which government gives freely to pregnant and lactating mothers in the hospital. So anyone will lack, or the victim lack, it has a consequence for that. So these are all various forms of macronutrient deficiencies. Even iodine, lack of iodine causes what we call goiter. You can see in the village or community, you see the thyroid gland here swelling up. It's because of lack of iodine in the food, the person, on the diet of the individual.
But then what would you say is the standard or global best practice and recommendation for a country like ours to achieve stable nutritional balance across board?
A lot of strategies have been set up to address some of these things. A lot. Governments, in their infinite wisdom, came up with what we call fortification, industrial fortification of some of our products. Fortification just means addition of micronutrients or nutrients to improve the nutrient existing in those foods. But this is done industrially. That was why in Nigeria, if you look at within the last 10 or 15 years, you see some products, we said this product is mandatory fortified. Government said every flour coming in or produced in the country must be fortified with vitamin A. That's why you can see that flour with I logo, which shows vitamin A. It's for us to consume these foods so that we will have additional supply of vitamin A in our food. We also have iodine in the salt. This iodine in the salt is to help us to address the iodine deficiency, which is the result to goiter. Right? We also supplement iron folate, which we give free at antenatal health facilities. And you remember, some few years, even presently, twice a year, you see health workers visiting homes, giving children vitamin A supplementation. Maybe you must have seen them. So they give them vitamin A capsules so as to make up the daily required amount of vitamin A they need. Because the food we consume does not contain enough of these nutrients for us. Right? Yes, okay. Then for instance, the pap that we give to the child. If this pap is not fortified, you continue to give that the child pap, you see that the child will begin to develop deficiency, become malnourished, either kwashiorkor or marasmus will develop. Because that pap alone cannot supply the daily micronutrient requirement for that child for a healthy living. So what do? Government said, okay, you can improve this pap now by adding what we call macronutrient powders. These macronutrient powders are distributed free of charge in the country. It contains 15 essential minerals and vitamins. And when you add it, when you consistently add it to the child's food, the child will develop normally and survive.
What other interventions is government or has government put in place or putting in place to ensure that this acute malnutrition that we are at the risk of at the moment in the country, in parts of the country, we're able to find a way around it and move us from there? Apart from government, even what about the efforts of both at national and subnational levels, at international organizations and private other support system that we can have, a cohesion of all of this to achieve what we hope to achieve?
Yeah, thank you very much for that. You see, government alone cannot achieve or, address this issue of malnutrition. So that is why we are always in collaboration with our partners, either international or donor or local partners, to make sure that the issue of nutrition is addressed in this country. Now, you are asking what are other things government is doing. Yeah, for the already malnourished child, government has a strategy of treating them as a commodity we call RUTF, ready to use therapeutic food. This is used to treat an already malnourished child, some child, severe acute malnutrition child. So these commodities are used at health facilities. We call it OTPs in our PHCs all around the country to treat a child. When a child is identified in the community and brought to the health facility, the OTP, the health worker that has been trained on this knows what to do. And the child is placed on this ration for 12 weeks. And you discover that within 4 weeks or 6 weeks, some children recovers and they are discharged. While if some of them fail to recover, it means that there is an underlying issue. The child is referred to what we call to a health facility where he will be treated. That underlying issue will be dictated and treated, or we call it stabilization center. And then thereafter, they are turned back to the health facility to collect this RUTF, which is given by the mother at home.
Thank you so much. We have been speaking with Chief Europa John, who is a director at the Federal Ministry of Health here, and he's been talking about the issue of acute malnutrition. The program continues shortly. Stay with us.
This is the only clinic in Muna IDP camp where displaced persons access healthcare services. Many women are here with their children for medical examination to see if they are malnourished. The facility, since the beginning of the year, has recorded 703 cases of malnourishment and is still counting. Yagana Bakura said she is not surprised her child has the symptoms because the camp has not been provided with food and other needs for a long time. We have been coming here for treatment for 2 days now. They gave us supplements and they told us our children are hungry, which is why they are sick. We can't go back to our communities because it's not safe. We need food for our children. Back then, they provide us with relief materials, but they have stopped since the time all IDP camps were closed. Our children are suffering from this malnutrition. We need help, please. It is reported that there are 2 million children suffering from malnutrition and 700 acutely malnourished in the northeast region of Nigeria. In one of the medical facilities where critical cases are being handled, a medical practitioner says global attention and humanitarian support are needed to mitigate the menace.
January to end of April, we used to see patients at the admission rate of 6 to 8 per day, but now this year we are seeing about 30 per day. So that indicates that this is almost 3 times more than what we used to see previously. So this shows that the trend is increasing, and it's really alarming that more cases, we expect to see more cases. Yeah.
So how far with the treatment so far?
Yes, for our facility is 120 bed capacity. We have 120 bed for the malnutrition, for the malnourished kids. And as I'm talking to you now, the 100 bed is now almost at 100% bed occupancy rate. And that shows that more patients are coming and we are treating them.
The menace of malnutrition in Borno State is connected to the insurgency, which has caused food crisis and denied farmers access to their communities to engage in agriculture.
Welcome back. If you're just joining in, this is a program, Health for Living on Trust Television, where we have been taking a look at the way forward regarding the acute malnutrition that some parts of the country is facing. And I have with me here at the moment Dr. Temidayo Odebumi, who is the head infant and young child feeding branch nutrition division of the Ministry of Health, to help us continue this conversation. Welcome on the program.
Thank you very much.
What other measures do you think should be put in place, or is a way forward for a country like ours to step away from this issue?
Prevention is very key. And he already told you some measures. One very important key will also use the promotion of breastfeeding. Breastfeeding seems very simple. Breastfeeding seems always available. We don't regard the importance, but a focus on breastfeeding alone can change the narrative for us. And breastfeeding is one of the most, if not the most, cost-effective methods to prevent malnutrition in any country. So breastfeeding is very important, and the Federal Ministry of Health prioritizes breastfeeding. As a ministry, the government through the Federal Ministry of Health prioritizes nutrition. We know the impact of nutrition in any society. If the nutrition of the people is undermined, the human capital of that community is already undermined. So we know the importance. And the first thing to do is breastfeeding. You know, it all starts when a baby comes into the world. The first thing to do is breastfeeding. And the first thing I would say is breastfeeding provides food security in the first 6 months of life. You know, one of the things we said is one of the causes of malnutrition is unavailability of food, food insecurity. But with exclusive breastfeeding, research has shown that a child can be fed only breast milk for the first 6 months of life, and that's the recommendation, the Federal Ministry of Health recommendation. So for that first 6 months, for that baby, there's food security. You don't need to look for money. Poverty is not a problem. You don't need to even reduce cost for the families.
So I understand that many people believe that breastfeeding is the mother's job alone. And does a woman actually need support to breastfeed?
Thank you for that question. Breastfeeding, people think breastfeeding is the woman's job, but for a woman to actually breastfeed optimally, by the word optimal means as in breastfeed according to recommendations, she needs support. And she needs support we have a whole group of actors involved in this. The woman's job is to breastfeed, but she needs support, number one, from the partner, that's from the husband. You might ask me how, since she's the one that has the breast and is breastfeeding the baby. But from right in the home there, remember that this baby needs to be breastfed. If she will be practicing exclusive breastfeeding, which is only breast milk for the first 6 months of life, that means she will breastfeed day and night. And she will breastfeed on demand. We recommend breastfeeding on demand. That is, anytime the baby needs to be breastfed, you breastfeed. She will need support in the home with house chores, with taking care of older siblings. Then she also needs that emotional support. She needs someone to pat her back and let her know she's doing a good job. Let her know, you know, women need there's this emotional feeling of, oh, I'm doing so much, nobody cares. That will encourage her. Then she also needs support from the health workers, from the health system generally. At the facility, when she goes to register for antenatal, she needs to be well informed about what breastfeeding is. For example, a first-time mother, not only the first-time mother, she needs to know what breastfeeding entails, what to expect during delivery, what to expect the first hour. She needs to know that this baby needs to be put to breast within the first hour. So she's already excited, getting ready for breastfeeding. So the health worker supports her. When she delivers, irrespective of the mode of delivery, whether spontaneous delivery or cesarean section, the health worker is there by her side to help her put the baby to breast. She also needs support from colleagues. For a working mother, she needs support from colleagues at the workplace. She needs support from her workplace. She needs a breastfeeding-friendly environment. If there's a crèche available, even if there's no crèche, there might be a nursing room where she can go to nurse the baby, or express milk. She needs support from the society. Public places can help. Supermarkets. I've entered a supermarket in Abuja here where I saw a nursing corner. I was so impressed. So to breastfeed on demand, you need that support. She enters a very busy supermarket. Baby is crying. She needs to breastfeed. Just a corner designated for nursing mothers where she could have the privacy to sit down and nurse her baby. So she needs support from the entire community, trade unions, everyone has a role to play to support breastfeeding women.
Regarding infant feeding, what is the Federal Ministry of Health doing to ensure that this is optimal?
Okay, I'll begin by telling you the national recommendations. Okay, the Federal Ministry of Health recommends for infant feeding. The Federal Ministry of Health recommends early initiation of breastfeeding within the first hour of birth. That is, breastfeeding started, the child must be put to breast within the first hour of birth. Then exclusive breastfeeding for the first 6 months of life, meaning only breast milk, no water, no added fluids except drugs recommended by a doctor. And continued breastfeeding for up to 2 years or beyond, with the addition of adequate complementary foods from 6 months, appropriate for age. And the Federal Ministry of Health, to achieve this, we know that mothers need support, as I said before. So the starting point is ensuring that health workers are adequately trained. To support someone, you need some information. You need to be equipped to be able to support them. And the starting point for us, and every actor is important, but for us, the health workers are very important. And presently, the Federal Ministry of Health just concluded the review of our maternal, infant, and young child nutrition training manuals. And we'll be starting out with the national training of trainers, training health workers across the nation to ensure that these health workers, their capacities are built, and they will then be able to support mothers and be able to train community volunteers at every level, such that not just at national level, state, at the grassroots also. And let me also add that for breastfeeding, another thing that undermines breastfeeding is the unethical marketing of breast milk substitutes. That's infant formula. There's a national regulation on that, on marketing of breast milk substitutes, and the agency that has the mandate to implement that is in NAFDAC. So we're working very closely to ensure that is implemented, the code is not violated, so that mothers are protected.
Thank you very much, Dr. Temidayo Odebumi, who is the head of Infant and Young Child Feeding Branch, Nutrition Division of the Ministry of Health.
Thank you very much.
With that, we've come to the end of the program, but remember, to eradicate acute malnutrition in Nigeria, it has to take collective effort. Even apart from food security, there has to be that right information given to people so they know the way forward and what to do and what not to do. For comments, contributions, and suggestions on this episode, do well to subscribe and follow us across all of our social media platforms. I'm Aisha Salihu. Thanks for watching.